Welcome to my poster. I'm presenting on the application of the 7-step action plan to strengthen quality midwifery education in Zambia. So I work for SID Global Health, as you may know, and we partnered with LUSAKA College of Nursing, LUCON, with University of Zambia as well. And for LUSAKA College of Nursing, we have partnered to strengthen midwifery training. And for the University of Zambia, we've partnered to strengthen, family medicine. We are training family medicine doctors. So when we just partnered, we requested the Ministry of Health. Of course, we started engaging the Ministry of Health to give us a partner, a midwifery education college, which we can strengthen. And the Ministry of Health was happy to give us LUSAKA College of Nursing and as the college, and then they gave us Matero first level hospital as our clinical site where we're going to follow up with the students. So when we started, we followed the World Health Organization and ICM 7-step action plan. So this action plan can be applied at any stage if you want to strengthen midwifery education. So this is the cycle that we did to apply the 7-step action plan. And we started with the alignment with government. After the alignment with government, we gathered data. So the assessment that we did was we did the focus group discussions, we did the surveys and interviews of students, those who have graduated and those who were in college at that time. After the assessment, we had to present the results. So we held the 3 days stakeholder workshop where we presented our results. And some of the results that came out are these ones. I don't know whether you're able to focus them. So we looked at the students' preparedness for clinical placement. We looked at factors that helped, prepare students for clinical rotations. We looked at the adequacy of skills labs. We looked at student learning opportunities, clinical skills, confidence of graduates. We looked at shortages of supplies and equipment. We also looked at the clinical instructors as mentors. So after this, some of the results that came out, the challenges from the results, as displayed in this graph. So you see that lack of time with clinical instructors was quite high. So 61% of the students said there was no time with the clinical instructors, and 45% said there were too many students per clinical instructor. So you find that, one clinical instructor, I'm sure you're aware how, the number of students are, challenging as the ratio of the students and the clinical instructors. So the other thing was some students felt they were intimidated with the learning environment, while others saw that there was, lack of hands-on learning. So they would just be roaming around the corridors without touching any patients. The others, 22%, felt that there were competing priorities for time during rotations, and also lack of support from school during rotations. They felt like they were just dumped and then nobody followed up. Some were disinterested from clinical instructors. They saw that the clinical instructors were not interested, or them were not interested, to work with the clinical instructors. So after the assessment, we now used the results to prepare the clinical sites, which were identified by government. We equipped the first level hospital, Matero, with the delivery packs. We also bought, some mannequins for the skills lab so that the skills lab was adequately, prepared. After the equipping with the equipment, then we started training. We trained the preceptors. So far we've trained 40 preceptors, and after next week we are training another 20 preceptors who are helping with the, mentoring the students. The other step that we did, the 7th step, was to, equip now the trainers, the educators. So we've trained the educators in the skills, and we are yet to train more. We've so far trained just 15. We are yet to train some more educators what we want, as we are training students before they graduate, educators should also have the skills. So instead of us outsourcing, getting trainers to come and train students, the same clinical instructors are doing the training. And that's how the cycle is. So in conclusion, we feel this 7-step action can be used even for any other colleges. So we can strengthen actually a midwifery education in Zambia by use of this 7-action plan. Thank you very much.